Today we'll be talking about immunosuppressant. Tacrolimus is a powerful immunosuppressant primarily used in kidney transplant patients to prevent organ rejection. It was originally discovered in the 1980s from a soil bacterium called Streptomyces tuberculosis in Japan. Tacrolimus belongs to the macrolide lactone class, which refers to its large ring chemical structure. Its discovery marked a significant advancement in transplant medicine due to its potent ability to suppress immune responses more effectively than previous drugs like cyclosporin. Today, it's one of the most commonly prescribed medication for the post-transplant care. Its role is critical in maintaining the health of the transplanted kidney, reducing the risk of acute rejection, and helping patients lead longer, healthy lives post-transplant. Tacrolimus targets the calcineurin signaling pathway, which is crucial for activating T cells. When tacrolimus enters the cell, it binds to the protein called FKBP12, forming a tacrolimus-FKBP12 complex. This complex then binds to and inhibits calcirin, a calcium calmolin dependent phosphatase. Normally, calcirin dephosphorylates the nuclear factor of activated T cells, allowing N-fat to enter the nucleus and promote the transcription of interleukin-2 and other cytokines. By blocking calcirin, tacrolimus prevents N-fat activation, effectively halting T cell activation and proliferation. This mechanism is central to its immunosuppressive properties, especially in the context of organ transplantation. Tacrolimus exerts its immunosuppressive effects by suppressing the transcription of interleukin-2, a cytokine essential for T cell activation and proliferation. Without IL-2, T cells cannot multiply or launch a coordinated immune attack. This is primarily important after a kidney transplant, where the immune system would otherwise recognize the new organ as foreign and attempt to destroy it. By reducing IL-2 levels, tacrolimus prevents this immune-mediated rejection. Furthermore, it dampens the cytotoxic immune response that involves both helper T cells and cytotoxic T lymphocytes, reducing inflammation and tissue damage associated with transplant rejection. By inhibiting the calcirin pathway, tacrolimus significantly downgrade the immune system's response to the transplanted kidney. This reduction in immune activity lowers the chances of both acute rejection, which can occur within a few weeks, of transplantation, and chronic rejection, which can gradually damage the graft over months or years. Tacrolimus essentially creates an environment where the immune system is less likely to attack the transplanted organ, promoting long-term graft survival. It does so without entirely shutting down the immune system, which helps maintain some defense against infections. This balance is crucial for transplant receptives to live healthier lives with a functioning donor organ. While tacrolimus is highly effective, its use requires careful clinical management. One of the biggest challenges is its narrow therapeutic index, meaning that the dose must be precisely calibrated to avoid toxicity. Too little of the drug and the transplant may be rejected. Too much and the patient may suffer from adverse effects. Common side effects include neurotoxicity, which is ironic considering its use for kidney transplant, as well as hypertension and neurotoxicity, such as tremors or confusion. Patients on tacrolimus undergo frequent blood tests to ensure the drug remains within the safe and effective range. Despite these challenges, it remains a cornerstone of transplant immunosuppression due to its effectiveness. In conclusion, tacrolimus has revolutionized the field of organ transplant, especially for kidney receptants. Its unique mechanism of action binding to FKBP12, inhibiting calcineurin and blocking IL-2 transcription allows for precise and effective suppression of T cells activity. This targeted immune response plays a key role in preventing both acute and chronic rejection, greatly improving transplant outcomes. However, the drug does come with significant risk, making monitoring essential. As research continues, the goal is to maximize tacrolimus benefits while minimizing its drawbacks, ensuring that more patients can enjoy longer, healthier lives post-transplant.